Technology and innovation are reshaping anesthesiology faster than ever. I invite the chairpersons for this session, Dr. Shashindran, Dr. Sunil, Dr. Manjit George, to the stage.
AI is no longer the future, it is the present. I invite Dr. Sharon Basil, Associate Professor, Department of Community Medicine, MOSC Medical College, Kolanjeri, recipient of Best App Award in Community Rehabilitation from the prestigious MIT Institute USA, onto the dais.
We are living in a world of AI. To enlighten us regarding this subject, we have Sharon Basil, an authority in this field. Over to you, sir.
Good morning, everyone. So I'll be doing a quick bird's eye view of what exactly are the new AI tools that is available in anesthesia, as well as in critical care. And I'll be covering it in a way like I'll be covering all the high-tech ones initially, which are having a high price point, followed by the free ones, so that you can straight away use them, maybe from today itself. So the primary pain point that these AI tools wants to address is one, like if you are in an OR or in an ICU, you will be having so many monitors and you will be having this alarm fatigue. In addition to that, you need to have so much writing involved, like post-op notes, anesthesia notes, so many pre-op notes and all. So they want to introduce the AI for a scribing pattern as well. So one of the main tool which is used by anesthetists in US and UK, this particular tool, basic concept of the scribing is like you simply need to talk with the patient in any language you want, and it automatically detects that. Even in the colloquial style also it detects, and automatically it writes your notes in the exact same format that is used in your department. It can even do the ICD classification of the disease. Everything will be done automatically, and the final report will be shown to you, which you can do the verification. So the most common tool that is used for this is called Health Orbit AI. Again, this is not completely free. So this particular tool comes with a 14-day demo and has a cost of around 40 euros and all per month, but it's expensive. But there are so many free alternatives also available. And the main attraction is like most of the scribing tools, they are not tailor-made for an anesthetist. Most of the tools are mainly for doctors, and we can customize it for an anesthesia purpose. But this particular tool is anesthesia specific. So it has got all the standard guidelines and formats and all those, everything that is needed for an anesthetist is already pre-built in within this particular tool. Two other alternatives are called, one is called Freed AI, the other is called Tally. Both the tools are having the same function. Again, these two tools are not tailor-made for a anesthetist, but for the broad specialty. But the previous one, that is the Health Orbit one, is specifically for an anesthetist. Second interesting aspect is how to overcome your fatigue regarding the monitors. Like you will be having so many patients in your ICU or NOVA, and traditionally we will be depending on that beep beep sounds whenever some values go below, right? So now with the AI part, the thing is like AI they, straight away take care of this, and it has its own advanced algorithm for analysis. So even before the patient deteriorates, ideally they are telling like it can automatically detect deterioration 5 to 8 hours before the alarm goes out. So that proactively it gives you advices telling like this patient's parameters suggest that this is going down, and it will automatically show you a projected timeline or projected graph on how the patient's parameter will be after 5 hours. So based on that, you can proactively give the medicines and to prevent that mishap. And once you give the medication, it automatically generates the graph so that you can see whether your medication that you have addressed right now is effective or not. And two main AI tools presently that is focused on is, one is called Clue AI, the second is called Ethiometry. These are the two tools. And Clue ICU is the most famous one, which has this 8-hour prediction, advanced prediction, early prediction algorithm built in, and they are telling like rather than our traditional alarm-based detection, this one is 5 times more accurate rather than our traditional one. Ethiometry, on the other hand, is slightly different. What they done is like they created so many indexes of their own, and this particular tool, this is like a device along with an AI tool. So this can automatically gets data directly from various aspects. Like it can automatically connect to the EMR and automatically analyzes the lab data of the patient. We don't need to feed it. Get all the data from all your connected devices and vents and from the monitors. And based on that, it creates indexes. And all these indexes are not routinely used by us, because most of these indexes are created by them, and all of them are cleared by FDA. So one such indicator is inadequate oxygen delivery index. So such index may not be there right now, but this particular index they have used and they have copyrighted. And this particular indexes are highly effective in doing advanced prediction many hours before the deterioration. So these are the interesting aspect. Third aspect, this you might be already familiar with this. This is a cloud-based ICU monitoring system using AI. So the two main aspects is one is Cloud Physician, the second is called Philips eICU. Here the tier 1 and tier 3, tier 2 like lower facility ICUs, they can have a Cloud Physician like subscription, and they automatically get like they feed their video data directly to the central portal. There AI automatically analyzes the video feed, identify those patients who needs intervention, automatically gives real-time information to the intensivist who is there in that ICU, and they will help to manage the patients easily. So basically it reduces the requirement of number of faculty or number of doctors who are required in the ICU. Now the last one in this category, this is a really interesting device that is generated by an Indian startup. So this is called DOSI. So this one is mainly not focused for an ICU. This is mainly for when the patient get discharged, but patient is bedridden and needs continuous monitoring at home. So this is like a sheet, just almost like a bed sheet made of a rubberized material having so many sensors. And here this is a sensor and in the middle area. So this particular sensor is usually kept under the bed, and when the patient is in the bed at their home, and when the patient rolls around and they inhales and all, the sensor is so accurate, so sensitive, it can detect all those vital statistics based on the patient movement as well as the movement of the chest, and it automatically calculates all the data and send it to a remote doctor. That is, suppose if you are having the system in your hospital, automatically feeds the data and automatically telling you, even though patient is located at his or her home 40 kilometers away from the hospital, you will get a real-time monitoring of the patient. And it's not expensive also. This is costing around 12,000 per sheet. So it's affordable. And I think renting type of system can also be considered, why patient shares the cost of this device, and once they have crossed the requirement, they can bring it back to the hospital. Now I come to those aspects which are a bit more interesting rather than theoretical aspect, where you can use AI as an anesthetist, especially if you are working in an institution where you have DNB or where you have PGs. Okay, so this one is how you can create very interesting PPTs using AI. So the tool, this is 100% free to use. This is a tool by Google, and its name is called NotebookLM. So they created it mainly for teachers, students, and researchers. Concept is very easy. You just open NotebookLM, log in with your Gmail ID, and in that you can see on the left side, you can see you can attach whatever material that you want. Here in this scenario, in this sample, I attach the Miller's Anesthesia 9th edition textbook directly. So whenever I want to create a PPT out of any topic, the entire content will be coming out of this Miller's Anesthesia. So whatever definitions, values, everything. So it won't be having any hallucination. Any wrong parts won't be there. And on the right side, you can see there is a studio area where you can create videos, audios, PPT, and so on. The one we are interested in is the one I highlighted, that is called slide deck. So when I click on that pencil icon on the slide deck, I will be taken to a page like this, where it asks you like how exactly you want the PowerPoint. So it has got two categories. You can see there is one detailed deck section and a presenter slide. Presenter is the one which has more number of pictures, more vibrant images with less text, whereas the detailed one is the one with more text and lesser images. Then we can decide the language, whether it can be English, Malayalam, Hindi, depending on our requirement. And the duration is how much slides that you want. It's a longer slide or a shorter slide. And beneath that, you can mention the topic. Here in this sample, I mentioned create a vibrant slide deck on malignant hyperthermia, OT preparedness and management. Use realistic visualizations and illustrations. Target audience are anesthesia postgraduates in India. Suppose if I'm planning to take a class on that. Now the most interesting part is like it can accurately create so many visualization that we use regularly. Like it can create an accurate ECG on any aspect, any content, any topic which is not given in the textbook. It can create so many radiological images, different types of scans, everything with almost 99.99% accuracy. So on creating this was the PPT that was created. So it created a beautiful front slide. Then it started discussing various aspects, and you can see the level of details and the quality. And previously there were so many spelling mistakes, but now it corrected everything, so there are no spelling mistakes. It creates a 3D visualization at the microcellular level with all those details. So if you are manually creating such a PPT, we won't be able to reach this level of clarity and accuracy. Like you can see that vibrant coloration, and we can even decide the theme also. Suppose if I am telling like go for a white and electric blue theme, so everything will be in that theme only. So like that we can create. And once we create the PPT, there is a revise option in which, suppose if you feel like you need some change in the slides, you, instead of doing it manually, just give that instruction on that particular slide, and it will recreate the PPT with that modified change. And you can do it many number of times without paying anything. And this is another slide on different types of options, protocols available for this thing. And I'm sure that these images are not there in Millers, so these are AI generated. And then a slide on targeted temperature management, the various options and so on. So like when you're like taking a class using these PPTs, you will definitely get that wow factor from the audience, right? So, and it's free to use. And coming to the next aspect, when you want to get some evidence-based information using AI, the main thing is like if you are going to ChatGPT and ask some questions, the thing is like most of the times there will be some errors. Then this particular tool is called Glass Health. Okay, so this is a tool, and this particular tool is called ChatGPT for doctors. So this particular tool is having its base on JAMA and UpToDate. So everything will be evidence based. So you can use it for free. There is a paid plan, but their free plan is highly generous. Suppose if I want to get an evidence based answer on an anesthesia scenario, say the question is continuous neuromuscular blockade beneficial for patients with severe ARDS. If I ask that in ChatGPT or Gemini, there can be some errors. But if you ask in Glass Health, answer will be getting in this manner. So it will give you a brief summary of the correct answer followed by evidence from highly authority journals. You are usually coming in the Q1 category, and will come with all those references which I have highlighted, so that you can reliably depend on those tools to get instant information on any aspect. Now the another aspect is we can actually now use AI for app building specifically for anesthesia. What you need to do is you might be familiar with an AI tool by Google called Gemini. This is completely free. Within Gemini, when you open Gemini, you can see there's a tool section. In that there is an option called Canvas. So just activate Canvas. Again, this is free to use, and simply give an instruction on what exactly you want to build. Okay. So here I mentioned like I want to create a BMI calculator in black and white, black and yellow theme. There should be boxes to enter the weight in kilogram, height in centimeter. There should be a calculate button which on clicking should show the BMI category and advice in a vibrant way. So rather than me creating the code, I'm just simply instructing. So based on that, it instantly creates a BMI calculator. Okay, just like that you can create calculators or different tools based on many aspects. So I will show you two such tools created by two anesthetists. So this is one particular tool created by Dr. Jyoti Deshpande. She is an anesthetist from Pune in Symbiosis Medical College. So she is there in some of my sessions. So she sent me this personally. Her tool is post anesthesia assessment suite, mainly for detecting, deciding whether a patient should be discharged or not post, depending after the procedure. So on opening the tool, it comes something like this. It has got so many parameters which you can choose from. So there is physiological score is calculated. Then there is one on circulation, level of conscious, O2 saturation. So based on the patient's present condition, the anesthetist need to choose this thing. And it also creates an NRI, it has an NRI score slider which you can mention, NR score. And the lab feeds also can be indicated. And based on that, it creates a discharge readiness score. So based on the score, you can decide whether the patient is fit to be discharged from the ICU. And another sample is, this is created by Dr. Jeannie Chandran. She is an anesthetist from Baby Memorial Hospital. So this one is surgical blood loss assessment and management tool, which you can use during the surgery. So her tool comes with these aspects. We can mention some patient information like patient weight, baseline hemoglobin, patient category, blood loss details, then vital signs and so on, and it automatically creates a score, creates a value on how much blood loss is there and how much amount should be replenished. So all such different applications can be, like you will be having so many ideas regarding various tools you can create, but only hindrance so far is you didn't have the technical expertise to create it. But with AI takes care of that part. Only your instructions required, and you can keep on refining it any number of times. Now comes the last part, is how you can use AI for creating medical content accurately with beautiful visualization. Now earlier, if you want to create an image, this was a scenario. This was scenario till mid-2025. So if I tell AI to create an anatomically accurate heart, I get something like this with so many holes in the heart. All the labels will be having so much inaccuracy. Now what happened is, in mid-25, Gemini released an update called Nano Banana, which is one of the most powerful visualizing tool, and you can directly access it just by opening Gemini. In the home page, you will see an option with an option called Create Image with the banana emoji. Just click that, and automatically Nano Banana is activated. Then, if you tell it to create an heart, 3D visualization heart, it will be something like this. It will be completely accurate with beautiful visualization. It can create labels like this, straight out of Grey's Anatomy textbook style, and with accurate like labeling also, and even gross anatomy also it can create with this level of precision. So you can see it's almost looking real, and if I am not telling you this is AI generator, you believe like this is a real heart. So that's the level of clarity that is available. It can create microscopic cellular visualizations like this. We simply need to tell and it will create. Suppose if you are good at drawing and you have a hand-drawn image like this, you just load that to Gemini and tell it to create a like an illustration, scientific illustration. So this will be transformed to this manner. So all your hand-drawn ones can be transformed in any manner. You can create beautiful flowcharts like this, mind maps like this. And suppose if you are teaching, you're teaching say undergraduates, you want to create some comics also. It can create comics out of any topic. Okay. And the fun aspect is, say this is my wife. So in case you are the faculty who is taking the session, you can put your own photo. So automatically, instead of the character like this particular person will be the main character in the comic. So that students also love the character. So this is, she is an ophthalmologist, so I put on diabetic like retinopathy. So that particular person's face will be used as a main character in the comics. So this is another level, right? So students also love this. So my take-home message is like over the past 3 years, AI has been grown into extensive aspects, and this is really fun to use. And your quality of presentation, your presentation skills, and your respect that you learn from your students will actually go really high if you start embracing AI. So it's time to embrace AI. Thank you so much.
We are just like in Alice in Wonderland. Anyway, we can discuss it after at the end. Thank you, Basil.
Thank you.
Just one point to say. I've attended Sharon's workshop, one-day workshop, one of the best workshops I ever attended. And I have recommended his workshop to be included in our national conference coming up at Kovalam. I know this is a 15 minutes presentation, all crammed up, but he has done justice to it. So thank you, Sharon. We'll have discussion at the end.
Thank you, sir, for the fascinating glimpse into the future. Gentle reminder, ISACon National 2026 will be held in November in Kovalam. Register counter with special rate have been set up inside Hall A. Kindly make use of this opportunity.